So we have induced labor. Now, not every induction of labor will end up having a normal delivery. So what are the most common reasons when we decide for a caesarean section in an induced labor?
In a patient who has been induced for a normal vaginal delivery, the indications for cesarean would be first being failed induction. That is, we've induced pains and there has been no progress or absolutely no change even after using 2 different methods, and even after waiting for 24 hours, there is no change. That would be one of the indications for cesarean. The second would be that your membranes have ruptured and we can see meconium and there are fetal heart rate variations in the form of decelerations. That would be an indication. Most often how this happens is there are fetal heart variations, fetal distress, and when we rupture the membranes, we see that the baby has passed motion inside and you're in very early labor, that is, you're not about to deliver in the next 1 to 2 hours. That is one of the indications. The other one would be that you're fully dilated but the head is not descending at all. The head is not entering into the pelvis or not descending below the spines. Then that is an indication that the head is bigger than the passage, the space that is available. So in those cases, we will have to do a cesarean. And finally, if there is fetal distress, that is, we're not able to find any reason particularly, but constantly the fetal heart rate is falling, but not picking up, or picking up, but we call it as late decelerations. That is, in spite of the pain subsiding, still there is fetal heart rate falling. In that case, we will have to decide for an emergency cesarean. So these are the most common indications for a cesarean when we are trying for a normal vaginal delivery.
To add to this, as Dr. Shivani rightly said, failure of induction. Again, we can discuss this. We generally discuss with the patient. We waited for 24 hours as to what to do. If there is no other reason, like there's no fetal distress, there's no high blood pressure, and mother and baby are fine, we could still pull on for some more time on induction if there is no emergency indication.
That is, it has to be individualized on a case-to-case basis.
So that's where again I think the team practice really helps, because if you ask me, one alone person, to be monitoring you for 36 hours and then continuing to deliver you, well, that's humanly not possible. So to increase the chance of normal delivery, I think what we have started is really commendable.